Hello dear aspirants, welcome to GDC classes, welcome to GDC English classes, and today the session is on the Pharmacology demo class GPAT 2025 crash course. I hope you are already waiting since many days for this crash course. So the day is arrived and now it is up to you. So come and join this session and to going regarding this discussion on antipsychotics. So as you know that already, so GPAT is one of the prestigious examination for the pharmacy students. So after B Pharm, they will go for the M Pharm, especially they will look for a GPAT examination. So definitely GPAT is very easy. The first ingredient we have to be focused on our goals, and definitely you have to be interested on your purpose. And as you know that many people will go for write the exam, but only few people only qualified because of the thing is the lack of determination, the lack of passion. But definitely GDC not only learn about the subject, teach about the subject, it also teach how to make impact seriously on your goals, and how to crack your goals, how to reach your goals. And as you know, in the previous session itself, the 𝘂𝙎𝙎𝘾𝙄𝑖𝑎𝑐 sir give excellent introduction regarding the GPAT crash course, as well as the pattern of GPAT examination. So from different subjects, how the questions will appear in the details, the sir is already discussed. So today I will focus mainly on the content related. So I will discuss one topic today, that is psychosis, nothing but schizophrenia, and after that we will go in detailed discussion of pharmacology of antipsychotics. Pharmacology of antipsychotics. So because the everything is related to the psychologically. For example, if you have awareness regarding factors modifying drug action, factors modifying drug action. So in the factors modifying drug action, psychological factor is also one of the factors. Psychological factor. For example, if I am suffering from some cold, so I use some Sinarest something, so it works well. So next time also I will choose the Sinarest only, because psychologically it created impact in my mind. Yes, these drugs work very well. And even if you see the elders around 60 years, 70 years, or 50 years, if they use one tablet and next time also they prefer that tablet only, that color only, because psychologically impact is also plays the key role in drug action. So like that scenario, so the psychological factor is one of the important. First we have to be interested regarding particular object, and after that we have to be focused, and after that we have to be determined to reach that. So regarding that psychological level, so first we will discuss about the one of the psychological factor related disease, that is psychosis. That is psychosis mathemata schizophrenia. Psychosis mathemata schizophrenia. So what is simply psychosis? So psychosis mathemata, it is also known as a schizophrenia. It is also known as a schizophrenia. So what is schizophrenia? Schizophrenia mathemata splitted brain, splitted personality. Actually, Yes. So what is simply psychosis? Sorry for inconvenience. So what is simply psychosis? So psychosis nothing but it is also known as schizophrenia. Also known as schizophrenia. Schizophrenia. So psychosis nothing but it is also known as schizophrenia. So regarding schizophrenia, so schizo means splitted, phren means brain. So phren means brain, schizo means splitted. So splitted brain, splitted brain. So splitted brain nothing but schizophrenia, schizophrenia. So especially in the psychosis, what will happen? So the person become a psychotic person behave like he having a unorganized speech as well as unorganized thoughts as well as irregular behavior as well as having irregular behavior, unable to control. He is not in the reality. He is not in the reality. So psychosis nothing but the excess excitation, overactivity. So especially it is characterized by uncontrolled thought, uncontrolled behavior. So especially this is because of there is a domination of dopamine function in the brain. So there are many neurotransmitters are involved in the there are many neurotransmitters are involved in the psychosis and but major role is playing by the dopamine. Major role is playing by the dopamine and also serotonin. So there is also involvement of other excitatory neurotransmitters like glutamate, aspartate. There is also involvement of noradrenaline, some other neurotransmitter. But the key role is because of dopamine and serotonin. So dopamine is one of the key neurotransmitters in the central nervous system, especially excess function of dopamine. Especially excess function of dopamine in the central nervous system may lead to this psychosis nothing but schizophrenia. So schizophrenia means a splitted brain, splitted personality. I hope if you watch the movie Aparajit. I think it is generally basically a Tamil movie, but it is dubbed into the many languages. So Aparajit, in Aparajit, he having three characters. So that is also comes under the category of splitted personality, nothing but schizophrenia. Splitted personality, nothing but schizophrenia. And here, as I mentioned, so dopamine is one of the important neurotransmitter in the brain, and excess function of this dopamine may lead to the psychosis. May lead to the psychosis. So psychosis is characterized by unorganized thoughts, unorganized behavior. The person is not in the reality. The person is not in the reality. So here to get into this topic in clear. So we have to first understand how the dopamine is playing a key role in the development of psychosis, development of schizophrenia. So for that purpose, we have to understand the role of the dopamine in the psychosis by knowing three basic pathways in the brain. So like how national highways throughout the country, in the brain also there are four highways for the dopamine. So one is mesolimbic pathway, mesolimbic pathway, and second one is mesocortical pathway, mesocortical pathway, and third one is nigrostriatal pathway. Third one is nigrostriatal pathway. Sorry for inconvenience. I think. So, nigrostriatal pathway, nigrostriatal pathway. Next one is a nigrostriatal pathway, nigrostriatal pathway. And fourth one is tuberoinfundibular pathway, tuberoinfundibular pathway, tuberoinfundibular pathway. So regarding this, so these are the four main dopamine pathways. These are the four main dopamine pathways: mesolimbic pathway, mesocortical pathway, nigrostriatal pathway, tuberoinfundibular pathway. So in this pathway, there is an involvement of dopamine, and each pathway having different functions. In each pathway, dopamine having different function. Generally, dopamine is one of the important neurotransmitter in brain as well as peripheral. But in the brain, dopamine is responsible for the addiction, motivation, euphoria, recreation, rewards. It regulates our emotions as well as total body movements also. It regulates our emotions as well as total body movements also. And especially the dopamine in the area of limbic system mainly regulates our behavior, emotions as well as motivations. So if there is the excess function of this dopamine in the limbic system, our behavior, emotions, motivations become the irregular. That become the irregular. Our all activities are become irregular in nature. So these are the four main pathways are playing key role with help of dopamine, especially in the development of psychosis, especially in the development of psychosis. So here, simply psychosis is nothing but uncontrolled behavior in the person, that is leads to the uncontrolled thoughts, uncontrolled speech, unorganized behavior. The person is not in the reality. And the key reason behind this is there are many neurotransmitters are involving, but major involvement by the dopamine and also serotonin and also other neurotransmitters like glutamate, aspartate, noradrenaline also. Noradrenaline also. So to understand what is psychosis, what are the symptoms of psychosis, we have to know what are the different pathways of dopamine involving in the brain and what are the functions of this dopamine and what happens if dopamine increase or decreased in these pathways. Dopamine increased or decreased in these pathways. Okay, let's see. So I already told that different pathways. So first one is mesolimbic dopamine pathway. Next one is mesocortical dopamine pathway. And next one is nigrostriatal dopamine pathway. And next one is tuberoinfundibular dopamine pathway. Tuberoinfundibular dopamine pathway. So mesolimbic dopamine pathway. So what is that? Meso means midbrain. In mesolimbic dopamine pathway, there is a connection between midbrain to the limbic system. There is a connection between midbrain to the limbic system. So there is if there is a excess dopamine function in this pathway, if there is a excess dopamine pathway, sorry, excess dopamine function in this pathway, what will happen? The excess dopamine function in this pathway, it may lead to the positive symptoms of the psychosis. For example, like hallucinations, false perceptions. For positive symptoms, why it is known as positive symptoms? Because here there is an increased dopamine function in this pathway. And when coming to the mesocortical dopamine pathway, when coming to the mesocortical dopamine pathway, it is between midbrain to the cortex. Midbrain to the cortex. Meso means midbrain. Cortex is mainly responsible for our sensory activities. Our sensory activities. So, decreasing dopamine in this pathway produces negative symptoms of schizophrenia. Decreasing dopamine in this pathway produces negative symptoms of schizophrenia. Next is nigrostriatal dopamine pathway. If you remember, not remember, you will be having awareness regarding Parkinsonism. So what is Parkinsonism? So Parkinsonism is a movement disorder. That's but it is also neurodegenerative disorder because of decreasing dopamine and increasing acetylcholine function in the substantia nigra nothing but nigrostriatal pathway. So in this nigrostriatal pathway, the role of dopamine to regulate our body movements. But our antipsychotics non-selectively. So antipsychotics, what they will do? In the psychosis, there is a domination of dopamine function. So that's why our antipsychotics, what they are doing? Decrease the dopamine function. So decreasing the dopamine function is essentially in mesolimbic pathway. But our antipsychotics, which decreases dopamine function in the nigrostriatal pathway, decreasing dopamine in the nigrostriatal pathway, what it will lead to? Movement disorder. Because presence of dopamine in the nigrostriatal pathway is essential. Presence of dopamine in the nigrostriatal pathway will develop, will regulate body movements. But decreasing dopamine in the nigrostriatal pathway develops a movement disorder, Parkinsonism. Next, tuberoinfundibular pathway. So, tuberoinfundibular pathway is related to endocrine system. Is related to endocrine system. So, presence of dopamine in this pathway decrease the prolactin release. presence of dopamine in this pathway decrease the prolactin release. But our antipsychotics block the dopamine receptors in this pathway and decrease the dopamine function in this pathway. So decrease the dopamine function in this pathway, increase the prolactin release. So excess prolactin release in the males may lead to the loss of libido as well as gynecomastia. And in case of females, it leads to the menstrual irregularities. So one of the major drawback of the antipsychotics is extrapyramidal symptoms due to decreasing dopamine in hypostatal pathway. That is example Parkinsonism. And another one is hyperprolactinemia due to decreasing dopamine function in the puberoinfrontibular pathway. The main intention of antipsychotics decrease the dopamine function in mesolimbic pathway, because mesolimbic pathway limbic system regulates our behavior, motivation, emotion. Excess dopamine function in the limbic system develops positive symptoms of psychosis, and decreased dopamine function in the mesocortical pathway develops negative symptoms. So negative symptoms because of decreasing dopamine function, the pronunciation. So positive symptoms because of increasing dopamine function, So let's go into the further details. Sorry. So as regarding introduction, I already dealt the things what are the basic level. So next, see here for more clear information what we discussed till now. So mesolimbic pathway, that is connection between midbrain to the limbic system, and it is a connection between midbrain to limbic system. It is responsible for behavior, motivation as well as emotion. So excess activity of this pathway may lead to increasing dopamine levels and develops positive symptoms. So the positive symptoms like disorganized thoughts, behavior, hesitation, that is tension feeling. So the positive symptoms like hallucinations, like what is meaning of hallucinations? False perceptions. And delusions. What is the meaning of delusions? False beliefs. And catatonia, loss of muscle coordination. So due to increased dopamine activity in the mesolimbic pathway, there is a development of positive symptoms of psychosis. The positive symptoms of psychosis like hallucination, delusion, catatonia, disorganized thoughts and behavior, as well as hesitation. And next, mesocortical pathway. It is a connection between midbrain to frontal cortex, that is nothing but cerebral cortex. This mesocortical pathway mainly regulates our sensory activities. And especially due to decrease in dopamine levels in the mesocortical pathway, there is a development of negative symptoms, because in this area the dopamine is decreasing, that's why negative symptoms. So negative symptoms like the trick is sulfa, so social withdrawal, unable to find pleasure, happiness, lack of motivation, unable to focus on the task, facial numbness, that is flattening effect, and alogia, alogia, lack of speaking skills. So especially loss of our sensory function. So decreasing dopamine levels in the mesocortical pathway develops negative symptoms of psychosis because of decreasing dopamine function. So decreasing dopamine function in the cerebral cortex decrease the sensory function, that leads to withdrawal from the society. So we are unable to interact with a group of people, and unable to find the happiness, and a lack of motivation, unable to focus on the task, and facial numbness, happiness, sadness, angriness, anything is there, but same facial expression, and elogia, poor speaking skills. Elogia nothing but the poor speaking. Please give 1 minute. Really sorry for inconvenience. Really sorry for inconvenience, students. So we are in the discussion of mesolimbic mesocortical pathway, which is responsible for the decreasing our sensory activities. And next is the nigrostriatal pathway. Next one is the nigrostriatal pathway. So regarding nigrostriatal pathway, so it is the part of brain that is regulates extrapyramidal symptom and regulates our body movements. So nigrostriatal pathway nothing but substantia nigra. In this pathway, dopamine presence regulates our body movements and it control our extrapyramidal system. Mostly all first generation antipsychotic block dopamine receptors in the nigrostriatal pathway develop extrapyramidal symptoms like body movement disorders, 𝘖𝙬 as well as Parkinsonism. So Parkinsonism is simply characterized by decreased dopamine levels and increased acetylcholine levels. You already gone through the pathophysiology of Parkinsonism in your previous semesters, whatever it may be. So Parkinsonism because of decreasing dopamine, increasing acetylcholine in the substantia nigra. And Parkinsonism is one of the major drawback. Parkinsonism is one of the major drawback of first generation antipsychotics because antipsychotics blocks dopamine receptors, dopamine function in this area. So decreasing dopamine function in the nigrostriatal pathway leads to movement disorder, Parkinsonism. Movement disorder, Parkinsonism. Next, tubero-infundibular pathway. Tubero-infundibular pathway. Regarding the tubero-infundibular pathway, so it is under the control of endocrine system. It is under control of endocrine system. Dopamine in this pathway decrease release of prolactin. So presence of dopamine in this pathway decrease the release of prolactin. That's why dopamine is known as physiological antagonist of prolactin. So tuberoinfundibulus pathway is one of the pathway like remaining three pathways. In this pathway also dopamine having function. Presence of dopamine increase the release of prolactin and prolactin release from the anterior pituitary. That is, dopamine is a physiological antagonist of prolactin. Like adrenaline is also a physiological antagonist of histamine. That's why adrenaline is a drug of choice for treatment of anaphylactic shock. Anaphylactic shock. And next, antipsychotics first generation causes hyperprolactinemia. The first generation antipsychotics causes hyperprolactinemia by blocking dopamine action in this pathway causes sexual dysfunction in males, that is gynecomastia or impotence, and in the females menstrual irregularities. So simply, to know the mechanism as well as to know the side effects, these four pathways are very, very essential. So psychosis nothing but the excess uncontrolled behavior in the person, uncontrolled thoughts, uncontrolled behavior, the person not in the reality, the person in the splitted personality. So, and especially the psychosis is because of dopamine. So regarding the dopamine, four pathways are there: mesolimbic pathway, mesocortical pathway. So increasing dopamine function in the mesolimbic pathway develop positive symptoms of schizophrenia, nothing but psychosis. Decreasing dopamine function in the mesocortical pathway develops negative symptoms of psychosis. And next, nigrostriatal pathway. Blocking dopamine function in the nigrostriatal pathway develops Parkinsonism, side effect of first generation antipsychotics. And decreasing or blocking dopamine function in the tumoral lymphatic pathway increase the prolactin release. So excess prolactin release also develops side effects. Side effects. Okay. So this is simply how the dopamine pathways with help of dopamine playing key role in the psychosis development as well as side effects development because of using antipsychotics. So, as we know already, so some of the psychological disorders here. So, depression is because of feeling of sad, tension, suicidal thoughts, especially decreasing noradrenaline and serotonin. And psychosis, especially because of distortion of thought as well as our perception also changes. Our way of perception changes, especially due to over domination of dopamine function. And mania, nothing but excess exhilaration, discomfort, fear about the future, especially because of increasing noradrenaline and dopamine levels. And anxiety, nothing but overactivity, excess tension, uncontrolled thoughts, non-stopping speech, increasing serotonin and decreasing gamma is characteristic feature of anxiety. So this is a simply, so what is depression, psychosis, mania as well as anxiety. So next, regarding the classification, there are two categories of antipsychotics are there. One is first generation antipsychotic, and second one is a second generation antipsychotic. So antipsychotics also known as neuroleptics. What is the meaning of neuroleptics? So they quiet the neurological system in the psychotic patient. In the psychotic patient, there is an excess stimulation, overactivity of the central nervous system. The person thoughts behavior uncontrolled, not in organized manner. So that unorganized patient, that excess psychotic patient make to the normal patient by using antipsychotic, especially by controlling the nervous system function. That's why these are neuroleptics. And especially antipsychotics are also known as major tranquilizers. They are also known as major, MAJOR, major tranquilizers. And sedative hypnotics are known as minor tranquilizers. So major tranquilizer means, what is the meaning of tranquilizer? A substance used to calm down the person. For example, etorphine is one of the opioid derivative like drug. Etorphine. So etorphine is thousand times. Etorphine is thousand times more potent than the morphine used to calm down the elephant. So tranquilizer nothing but the substance used to calm down the person. Here antipsychotics known as major tranquilizers, they use it to calm down the psychotic patient, make the unorganized behavior to organized behavior, make the psychotic patient to normal patient. And here, our antipsychotics major goal is to decrease the excess dopamine function in the brain. To decrease excess dopamine function in the brain. In that regard, there is a two subjects are there, nothing but two subdivisions are there. One is first generation antipsychotics, and next is second generation antipsychotics. So regarding these drugs, it's not like the important, so we know that. So bupropions, haloperidol, droperidol, phenphuridol, 𝘂𝙎𝙎𝙎𝙬, flupentixone, 𝘂𝙎𝙎𝙎𝙬, and other drugs like pimozide, loxapine, molindone, and phenothiazines like chlorpromazine, thioridazine, fluperazine, trichlorpromazine. So all these are known as first generation or typical antipsychotics. All first generation are typical or classical antipsychotics. What they will do? They act by decreasing excess dopamine function in the brain. And especially first generation antipsychotics are mainly for treatment of the positive symptoms of psychosis. So positive symptoms of psychosis examples are hallucinations, delusions, uncontrolled thoughts, speech, behavior, catatonia. The positive symptoms of psychosis are because of due to excess dopamine function in the mesolimbic pathway. So this first generation antipsychotics majorly focus on the mesolimbic pathway and decrease the excess dopamine function in the mesolimbic pathway. So in that regard, you can remember by using the like mnemonics, the first generation antipsychotics like metric B top. So B means first one bupropions, T means 𝘂𝙎𝙎𝙎𝙎𝙬, O means other miscellaneous drugs, P means phenothiazines. So what is the interesting thing regarding the GDC is, so not only going regarding basic level as well as concept levels, and definitely we will provide a tricks as well as mnemonics to easily remember the things, and definitely it will help you to reach your goal more easily regarding your competitive orientation. And next is the second generation antipsychotics. Next is the second generation antipsychotics, also known as atypical antipsychotics. The trick is POD. P means pines, and O means other miscellaneous. D means dons. D means dons. So regarding second generation, the pine drugs like acinapine, 𝘎𝙎𝙎𝙎𝙬, olanzapine, clozapine, and quetiapine. So both pines like pineapples. So pines comes under the second generation antipsychotic. And other like aripiprazole as well as satinol. Other like aripiprazole as well as satinol. Next is dons. So dons like giprazidone, and iloperidone, paliperidone, risperidone, and lurasidone. All those pipes, you can easily differentiate the first generation antipsychotics, second generation antipsychotics by pronunciation itself. So in the first generation antipsychotics, there is a bupropion, 𝘂𝙎𝙎𝙎𝙎𝙬, phenothiazine. Coming to the second generation, pines like pineapples, dons like drone. So dons all dons and pines all pines. So first generation antipsychotics are specifically for treatment of positive symptoms of psychosis. Second generation antipsychotics for treatment of both positive and less negative symptoms of the psychosis. Negative symptoms of the psychosis. So here, with a differentiation process, I will explain in detail in simple way. First generation as well as second generation antipsychotic. First generation as well as a second generation antipsychotic. So also known as classical or conventional or typical drugs. Also known as atypical drugs. Atypical drugs. And the first generation majorly blocks dopamine receptors in the brain, especially mesolimbic pathway. Especially mesolimbic pathway. And when coming to the second generation antipsychotics, block both dopamine as well as serotonin receptors in the brain. Both dopamine as well as serotonin receptors in the brain. And The first generation used to control the positive symptoms of psychosis. The positive symptoms of psychosis are because of excess domination of dopamine in the mesolimbic pathway. That is responsible for our emotions, behavior, motivation. Mesolimbic pathway. And second generation antipsychotics are the treatment of both positive as well as negative symptoms of schizophrenia. The positive symptoms of schizophrenia or psychosis because of increased dopamine in the mesolimbic pathway. The negative symptoms of schizophrenia are because of decreasing dopamine in the mesocortical pathway. Okay. And the important thing is the side effects. So side effects also you can easily remember how means let's see here. The first generation antipsychotics produces extra pyramidal symptom, that is movement disorder. One of the common example Parkinsonism. One of the common example Parkinsonism. So our first generation antipsychotics decrease the dopamine function in mesolimbic pathway, may also decrease dopamine function in the nigrostriatal pathway. Generally, presence of dopamine in the nigrostriatal pathway regulates our body movements. Regulates our body movements. But here our drugs decreasing the dopamine function in this pathway and decreasing dopamine in this pathway decrease the body movements. Decrease the body movements is one of the characteristic features of Parkinsonism, a neurodegenerative movement disorder due to decreasing dopamine levels. Due to decreasing dopamine levels. The extrapyramidal symptom, nothing but Parkinsonism, is because of blocking of dopamine function by antipsychotics in the nigrostriatal pathway. In the nigrostriatal pathway. But when coming to second generation, these are having less chance of extrapyramidal symptoms like but Parkinsonism, a movement disorder, because these drugs does not interfere with the dopamine activity in the nigrostriatal pathway. Very less chance. Okay. Next. And again, the same first generation antipsychotics produces hyperprolactinemia. Produces hyperprolactinemia. So, generally, what I told you, tuberoinfundibular pathway, presence of dopamine in the tuberoinfundibular pathway decrease the prolactin secretion. But here, our antipsychotics decreasing the dopamine function in this pathway. So decreasing dopamine in this pathway increase the prolactin release. So excess prolactin release in the males gynecomastia and loss of interest in sexual activities. In the females, menstrual irregularities. Hyperprolactinemia as well as extrapyramidal symptoms are the two major drawbacks of antipsychotics, especially first generation antipsychotics, to decreasing the function of dopamine in the nigrostriatal pathway, to decreasing the function of dopamine in the tuberoinfundibular pathway. Tuberoinfundibular pathway. And and when coming to the second generation, less chance of hyperprolactinemia because second generation drugs does not interfere with the dopamine function in tuberoinfundibular pathway. And when coming to the first generation antipsychotics, does not have any negative effect on metabolism of carbohydrates as well as lipids. But when coming to the second generation antipsychotics, they develop hyperlipidemia, weight gain, they develop hyperglycemia, diabetes. Both are because of pines, like clozapine, olanzapine, esinaprine. So pines means second generation antipsychotics. Pines means remember like pineapple. So excess eating of pineapples may develop hyperlipidemia as well as hyperglycemia. So in this regard, I am telling. So pines are second generation antipsychotic. Second generation antipsychotics interacting with the serotonin system. So second generation antipsychotics blocking dopamine as well as blocking serotonin. So due to blocking of serotonin, this second generation antipsychotics may interfere with our metabolism and increase carbohydrates hyperglycemia and increase lipids hyperlipidemia. That's why for our understanding and remembering purpose, Pines, nothing but pineapples. Excess eating pineapples may lead to hyperglycemia and hyperlipidemia. Okay, so next arrhythmias. Arrhythmias are also one of the drawback, especially the second generation antipsychotics like drone. So all drones like drones, excess movement of drone, also excessive movement of heart may develop arrhythmia due to QT prolongation, by the prolongation of QT interval in the heart. Nothing but ECG. So coming to the first generation antipsychotics, they having specific side effects like hyperprolactinemia as well as extrapyramidal symptoms, But when coming to the second generation antipsychotics, they majorly affect our metabolism, especially pines producing hyperlipidemia as well as hyperglycemia. And when coming to the domes, they producing cardiac arrhythmias due to excess cardiac muscle contractions. They may develop arrhythmias due to prolongation of QT interval. So let's see the mechanism of action of antipsychotics. So antipsychotics, first generation, second generation. First generation majorly focusing on the blocking dopamine function. Second generation blocking both dopamine as well as serotonin. Okay. So here generally sorry, tyrosine. So tyrosine converts to levodopa converts to dopa, and dopa releases and shows action on the dopamine receptors. So, especially typical first generation antipsychotics mainly block dopamine type 2 dopamine receptors in the limbic system, and coming to the atypical antipsychotics majorly blocking serotonin type 2 receptors in the mesolimbic system. So, atypical antipsychotics blocking dopamine as well as serotonin. So, atypical antipsychotics blocking the dopamine as well as the serotonin receptors. And what are the general clinical applications? So, what are the general clinical applications of the antipsychotics? So, based on the trick itself, antipsychotics. So, especially these drugs block the dopamine function. So, dopamine is one of the neurotransmitter involves in the vomiting production, emesis production. But these drugs are dopamine antagonist. So, decreasing dopamine also decrease the vomiting production. So, that's why these drugs are anti-emetics. Generally, the drugs acting on CNS should combine with anti-emetic, but antipsychotic itself decrease the dopamine function and acting as a anti-emetics. And also for treatment of psychosis. Yes, these drugs are common for treatment of psychosis, and also for treatment of Huntington chorea, and also for treatment of tic disorders. So A and TI. So as an anti-emetic, PSY for treatment of psychosis, CHO for Huntington chorea treatment, and TIC nothing but tic disorders. So this is simply in easy way you can remember the common clinical applications of antipsychotics, and even especially drugs like chlorpromazine used to control hiccups. Okay, so this is regarding our demonstration on the psychosis mathemata schizophrenia. So psychosis also known as schizophrenia. Schizophrenia mathemata splitted personality. The psychosis is mainly because of over domination of dopamine function in the brain, as well as little bit involvement of serotonin also. For that purpose, we detail gone through the mesolimbic pathway, mesocortical pathway, tuberoid pathway, nigrostriatal pathway. So, increasing dopamine domination in the mesolimbic pathway develop positive symptoms of psychosis. Decreasing dopamine function in mesocortical pathway develops negative symptoms. And decreasing dopamine function by the antipsychotics in nicotinamide pathway develops side effect extrapyramidal symptom Parkinsonism. And decreasing dopamine function in the tuberoinfantile pathway leads to the hyperprolactinemia. So examples of positive symptoms of psychosis like hallucinations, delusions, catatonia, unorganized thoughts, behavior as well as speech. Negative symptoms of psychosis like social withdrawal, unable to interact with a group of people, and a lack of speaking skills, lack of emotions, lack of interest on the task, unable to find the happiness. So these are negative symptoms due to decreasing dopamine function in the cerebral cortex and lack of sensory activities. Lack of sensory activities. And regarding the drugs classification, there are two generations: first generation as well as second generation. First generation antipsychotics are known as also known as a typical antipsychotic. Second generation are atypical. So regarding the mechanism, first generation mainly focus on the dopamine receptor blocking, especially type 2 dopamine receptors in the mesolimbic system. Coming to the second generation, having focus on both dopamine as well as serotonin receptors. First generation antipsychotics having specific side effects like extrapyramidal symptom Parkinsonism as well as hyperprolactinemia. And second generation having specific side effects hyperlipidemia, hyperglycemia, as well as arrhythmias, abnormality in the rhythm of the heart. I hope you got some idea regarding the what is psychosis, why it is known as schizophrenia, what is the role of dopamine, and how dopamine may develop the symptoms of schizophrenia in the form of positive symptoms as well as negative symptoms of the negative symptoms of schizophrenia. And after that, we gone to the drugs and detailed discussion of first generation, second generation in the definition manner. And after that, a easy trick with to remember the general clinical applications of the antipsychotics. So definitely you have some idea on psychosis. So like this, you study, so you can easily remember the things in easy manner. And definitely, pharmacology plays a key role in your success in GPAT also, because pharmacy is not but about drugs. So especially from the pharmacology in the GPAT orientation, 28 questions will be appear. 20 in 125 questions, 28 questions will be appear. So so it is inclusion of pharmacology, anatomy as well as pathophysiology. But definitely high preference will goes to the pharmacology. Nearly 20 plus questions always from the pharmacology itself. Definitely pharmacology is easy subject. For that the first ingredient should be interest, focus. And in the pharmacology, the main complaint is unable to remember the number of drugs. So there are many number of drugs are there. So we are unable to remember, like the students always complain. Yes, definitely. Whatever it may be, you are studying any classification. First, we have to practice on the paper. And the one of the advantages thing in the pharmacological classification is so like sartans. So all sartans are angiotensin to receptor blocker, like pills, angiotensin converting agent inhibitors, like backgrounds, amibagram, solobagram, beta 3 receptor agonist, like gliptins, sodium glucose transporter 2 inhibitors. So like that, mostly around 50% classifications are having specific advantage like that. First, you can identify that. So, gliptin, cetron, like ondan cetron, cetron. So, like these examples, many things are there. So, now itself in the psychosis itself, I discussed pines, esnapine, quetiapine, clozapine, olanzapine, dons, paliperidone. So, like that, while studying the things, you have to be focused, you have to be awareness, and you have to be studying in your own way. So, definitely, the things what I told, you can find in the textbooks. You can find in the textbooks and you can find somewhere. But definitely the way of teaching and the way of teaching from my side and the way of teaching from your side will make the difference. Will make the difference. So for more details, definitely we will correct in the future. And definitely you got the idea on the psychosis. So like this way only we will teach in the GDC classes. The main asset in the GDC classes is so we will provide daily life classes and you will already having the pre-recorded classes, and definitely you will provide the live sessions also when it required, and we will provide the excellent modules which are more than sufficient compared to the standard course, because the faculty who are teaching in the GDC always, sorry, all faculty are GDC as sorry GPAT as well as NIPER qualified faculty. So we are having experience. Definitely with that experience, we will help your goal to reach easily. Okay. So thank you so much for your presence, and as well as thank you so much for your cooperation. I hope definitely we will come. Nothing but definitely we will meet in the future classes also. So attend the remaining demo classes from tomorrow onwards also. Definitely you will get the basic idea how to approach in the different subjects for the GPAT as well as other pharma competitive examinations also. Okay, thank you. Hello. I completed my session. Thank you. Sir, आपने वहाँ से stop have you stopped the streaming on